Hi, my name is Neha. I'm one of the graduate assistants for IUP's Alcohol, Tobacco, and Other Drugs Office, and today I'll be talking about some of the populations that are vulnerable to substance abuse. We're just going to cover some basic information, but it's still important to know. So, according to the World Health Organization, they've collected some data about alcohol, drug use, other substance use, and millions of people worldwide are affected by these things. So you can see that about 283 million people are affected by alcohol use disorders, 35 million people are affected by drug use disorders, but all the way up to 360 million people have a dependence on nicotine. And then millions of deaths have also occurred worldwide due to psychoactive substance use. This does vary depending on what substance is used, but millions of people are unfortunately passing due to using substances. So, what are some of the risk factors for addiction? There are different levels of risk, so we'll just cover those now. On an individual level, your genetic makeup can predispose you to addiction. Experiencing early childhood aggression, having a mental health disorder, and then the psychological factors like stress can intensify your risk. On a relationship level, this usually deals with your parents. So, parental factors, parents who have substance use issues, mental health issues, and then parents who don't monitor their child or abuse their children are risk factors to an individual who may develop, an addiction. On a community level, what the individual is surrounded by, neighborhood poverty and violence, and then a peer group that uses substances are also risk factors for addiction. Societally, stigma and discrimination, harsh laws against substance use. So these are a lot of things that can affect a person and cause them to turn to addiction to cope. So vulnerable populations are unhoused individuals, women, adolescents, and young adults, trauma survivors, the elderly, veterans, LGBTQ individuals, injection drug users, and recently released inmates. So the role of stigma is a pretty big one here because it can create treatment barriers. There is stigma around people who have addiction. There's a lot of negative stereotypes. And this can be internalized and create someone might, think they shouldn't go to treatment, they don't deserve treatment, or maybe it's impossible, things like that. And then stigma can also be intensified because other parts of someone's identity might be stigmatized, like their race, if they've been incarcerated, or their gender, so they would be experiencing more than one kind of stigma. However, there are protective factors such as having a strong support network, having healthy parental involvement for children, academic success for the children, and as they grow, continued academic success and knowledge about substance usage is a great protective factor. So moving forward, these risk factors don't guarantee addiction, but being aware of them means they can be avoided or overcome. Same with protective factors, like having appropriate knowledge about substances is a great thing to know. And then knowing that you shouldn't have to be afraid to seek out help for yourself or a loved one. You should utilize the resources that are available. And here are some of the articles that were used in case you would like to read up on it further. Thank you.